are there sort of what we might call core age-related microbiota changes that, what we see in humans across the board? Yeah, that's a good question, and researchers are definitely looking at this. And before we give you a more definitive answer, I would just want to highlight it is a challenging area to research. Why? Because we know that everyone's microbiome is completely unique. So, there's no one on earth with the same microbiome composition as yours. Yeah, you might have some siblings that would be similar, parents that would be similar, but it just means that we're grouping people together. The disparity and differences between the microbiome are already so huge, it can be very hard to see patterns unless we start getting huge databases together of people, which we haven't really done yet in this field. Yeah, so as I said, there's great interindividual variability in composition, and this depends on some known factors too, like dietary factors, geographical location, lifestyle factors, birth and early childhood factors. If you're born by a C-section, you'll have different microbiome influences than if you're born vaginally. If you were formula fed, you'll have different microbiome influences than if you were breastfed. Antibiotic use is a huge one that we know that we can have, massive extinction level events from antibiotic use. And that could have occurred, 30, 40 years ago or 60 years ago in some cases if we're trying to research what changes, what people in the 60s, the microbiomes look like when they're 60, 70, 80 years of age compared to someone in their 20s. We have to try to take into account all these things here, including other medications that can influence the microbiome. And on top of that, we've got in the studies to date these different microbiome analysis techniques. So that has essentially precluded us to see a single sort of pattern that comes through and everybody gets the same sort of pattern. And I think from looking at different sort of disease conditions and microbiome correlations, I think we just generally don't ever see like a one single pattern. We might see a few different patterns that run through. Yeah, and I think this will be the case with this area too. And as someone who's just spent the time to read a lot of research in this area and try to look for things that should come through more consistently and are consistent with our current understandings of the role of different microbes in the gut, I'll highlight kind of the changes that we tend to see as people age in Western nations. So let's look at that. What are we seeing? Often a lower diversity. Yeah. And we know that a lower diversity is often associated with worse outcomes in older populations. So poor cognition and worse verbal fluency. In this particular study here, another pattern that comes up pretty frequently is increased proteobacteria populations. And proteobacteria is a pretty broad group of bacteria. Many known pathogens are in that grouping of bacteria. So that would be things like Salmonella or Shigella, Vibrio cholera, Yersinia, Campylobacter, Escherichia was one that's particularly noted in this population too. So a lot of microbes that the general public would see as disease causing are actually in the group of we could see as proteobacteria. And some like E. coli are ones we would call pathobionts, so species that are, when present in the right amounts, can do some great things and healthful things for us, but when present in excess amounts are causing harm. And that's what we see in the situation where we see these sort of blooms of E. coli as populations age. And we also see these blooms of sulfate-reducing bacteria too. And the key sulfate-reducing bacteria in the gut are Vibrio and Bilophila. And we can see pretty clearly from these graphs here that, and this is sort of age here, and these are 7-year gaps with the numbers between 1 and 2 is 7-year gap. So around 77 and 84 years of age, we see this massive bloom of Vibrio in the guts, and also not too dissimilar in Bilophila, we see these massive blooms at that sort of later age point too. And one of the key things that these bugs have in common is their capacity to produce hydrogen sulfide gas. And hydrogen sulfide gas is essentially a toxic compound that causes gut inflammation and prevents your colon cells from functioning properly, causes mitochondrial dysfunction. And we can detoxify. And in fact, a tiny amount of it actually has some healthful benefits, and we can detoxify it. But as we get greater overgrowth of these species, we can no longer detoxify it properly. And that's when we start getting the harm from excess hydrogen sulfide gas production. And I should point out too that E. coli can also produce hydrogen sulfide gas too. So we have this similarity in these groupings here. And these groups of bacteria, Vibrio, Bilophila, and E. coli, all produce very pro-inflammatory endotoxin as well. And we will talk about endotoxin or lipopolysaccharide LPS later on, but I just want to flag that there's something that they all have in common. What else do we see? We often see decreased bifidobacteria populations in aging populations. And we see decreases in butyrate producing species too. Yeah, and we know for many of you, we're familiar with butyrate, but it's a sort of healing anti-inflammatory compound. It's the main food source for your colon cells. But when we produce essentially excess to what our colon cells utilize or can utilize as a food source, then it starts circulating in our system. And we know it actually can have an anti-inflammatory effect, body-wide, definitely have anti-inflammatory in the brain, help generate new neurons in the brain, for example, improve blood sugar regulation. So it helps heal a damaged blood-brain barrier. So if you're having less of the butyrate being produced, you could see there's a bunch of flow-on effects that could impact metabolic health and cognitive function as a consequence. And we also see diminished Akkermansia concentrations too. And Akkermansia is one of the keystone species we see associated with good metabolic health, good gut integrity as well. Yeah. But I do want to flag too that in healthy older populations, we don't necessarily see this decrease of Akkermansia. And I'd also argue changes. We don't necessarily see the same decrease of butyrate producers or bifidobacterium. So there is a thing here of, yes, we commonly see this, particularly in Western populations who would argue age poorly, but we don't see them so much in people that age well. Yeah. And I think this quote sums it up pretty well, but reduction in beneficial species and enrichment of pro-inflammatory commensals is a hallmark of the aging microbiome. Now, I do think it's still best practice to assess the microbiome of each individual patient rather than making the assumption that they're going to have low Akkermansia or low butyrate or low bifidobacteria, because they might have some of that, they might have all of that. They may have erased E. coli, they may not. I think for me, it's really, I want to look at their individual microbiome, see what, if any of these patterns are relevant to them, and then we can target treatment much more effectively rather than just assuming that they're going to have this sort of pattern. But if obviously money is very tight and we can't afford testing, then yes, we can make assumptions around. There's no harm with making assumptions around, okay, let's feed your bifidobacteria, let's feed your butyrate producers. But I think we can target things much more accurately if we see exactly what we're dealing with. Now, one thing that's worth noting too, and I think this slide here shows it well, is we do see a sort of this pattern of an increase of pathobionts or pathogens and a decreased levels of beneficial species across the board as when people sort of die of older age or age-related conditions. What differs is perhaps when we see this, in that in Western nations where I'd argue we're often aging poorly, where our health span is longevity might be okay, but our health span is poor. You see this sort of blooming of problematic species and a decrease of beneficial species occurring in your 50s, 60s, and 70s. Whereas in populations who are aging well and have a good health span, that same change in microbiome composition occurs, but at 80 or 90 or 100. So we have this real capacity. Yeah, there is a pattern that we tend to see of increasing bad bacteria, decreasing good bacteria, but does that happen when you're 50 or does it happen when you're 100? And this is where we can influence with a number of factors we'll talk about later on. And we see the same thing that when we're having this bloom of pathobionts and pathogens, a decrease in protective taxa, we have increase in inflammation and we have frailty and degeneration occurring too. But obviously that's going to occur when you're 100 or it can occur when you're 60. And that really depends on many factors, but microbiota composition is definitely a key factor here. Now the image is just kind of showing what we might typically see as healthy adult, where we have low levels of inflammation. We have good levels of gut homeostasis. We have, looking at like the gut integrity is good. We have good levels of butyrate producing Firmicutes, for example. Low levels of opportunistic bacteria that are disease-causing or pathogens. Microbia are essentially Akkermansias in that grouping. Acinetobacter is basically bifidobacteria in that grouping. We have just like the right amount of bacteroides. But then in a typical elderly population that we'd see in Western nations like Australia, America, Canada, the UK, we see they have a lot more systemic body-wide inflammation. Their gut condition isn't so great. They tend to have dysbiotic changes in their gut. So they have less of these butyrate-producing microbes, less Akkermansia, but far greater levels of opportunistic bacteria like E. coli, or that I mentioned before, or the Vibrio or Bilophila that I got flagged before. But then we have this sort of in-between grouping of people that age well, so they have good health span. And there you can see their microbiome essentially resembles a bit of a mix between the two, but far closer to the healthy adult one. And we have less blood inflammation. We certainly have better microbiota composition that occurs. So I think that illustrates it pretty well.